All right, well, hello, everyone. I want to thank you all so much today for joining our webinar, where we'll be discussing VNS therapy, a different approach to difficult to treat bipolar depression with Dr. Gustavo Alva and Lana. And Dr. Gustavo Alva is a distinguished fellow of the American Psychiatric Association and a board certified by the American Board of Psychiatry and Neurology and the American Board of Geriatrics, and he completed his residency training at the University of California, Irvine, in the Medical Center in the Department of Psychiatry and Human Behavior. And he has also served as an associate professor and deputy director in the Department of Psychiatry at UC Irvine Medical Center and is currently serving as assistant professor at UC Riverside Medical School, Department of Neuroscience. And we'll also be joined by Lana, who lives outside of Seattle, Washington, was officially diagnosed with bipolar II depression in 2000, which is the same year she was implanted with VNS therapy, and she enjoys playing the piano, reading, writing, and gardening. And with that, it is a pleasure to have you two. Let's begin.
Phenomenal. Well, thank you so very much for the kind opportunity to have us on this live stream event. Obviously, as was made mention, the star of the show is Lana. And, we're going to be speaking about vagal nerve stimulation therapy, a different approach to difficult to treat depression. Quick point to note, vagal nerve stimulation therapy is indicated as an adjunctive long-term treatment of chronic or recurrent depression for patients who happen to be over the age of 18 and are currently in a depressive episode, and they've not had an adequate response to 4 or more antidepressant treatments. As was mentioned, I am joined by Lana, and like I said, she truly is the star of the show because Lana will give us a real world rendering of what it felt like to experience depressive disorder and go through the whole iteration of different types of treatments and approaches and not necessarily getting to where she wanted to be, and then finding vagal nerve stimulation and what her life's been like since doing so. Obviously, the kind introduction also shared with you that I've been doing this for over a quarter of a century. I've worked within the neuropsychiatric space for quite a long time and have helped with the development of novel treatments. One of the exciting areas of the neuropsychiatric space is neuromodulation. And one of the treatments of neuromodulation is vagal nerve stimulation, which we'll get an opportunity to discuss a bit more right now. First, though, we're going to talk about difficult to treat depression. We all, as humans, experience periods where we feel low. If we lose a family member or there's a significant other that's no longer there with us, we lose our occupational role, or we didn't get that job that we were after, we're going to feel bummed out and depressed and sad and down. And, that's a part of being alive. However, what a lot of people fail to recognize is that major depressive disorder is a medical problem that affects a lot of people. In fact, 1 out of 5 Americans will experience this problem through their life. We'll talk then that sometimes difficult to treat depression becomes really a conundrum for a lot of people. That then opens a door for things like vagal nerve stimulation therapy. We'll talk about the RECOVER study, a very exciting study that we're involved with right now. Lana will tell us what her perspective is all about, and then we'll have a chance to do a little Q&A. First, though, let's talk about the fact that if somebody suffers with difficult to treat depression, they're not alone. It turns out more than 2.7 million American adults suffer from the burden of difficult to treat depression. And the reason that it's important for us to have this awareness is that they're 2 times more likely to have very severe depression. And believe it or not, 98% increases in the likelihood of being hospitalized is not good news. It basically means then that if we run into difficult to treat depression, it's important to know what the definitions entail at the present time. The literature within the medical setting suggests that a failure to achieve at least a 50% response or 50% reduction in symptoms, meaning response based on tracking a certain time frame of, say, 2 months, would let us know whether somebody is not responding. If they're not remitting, that means that they're not able to get back to doing life the way that they want to do it. They can't get back to doing their occupational role or interpersonal role, the socialization that they're used to, or doing their domestic chores. So if you fail 2 or more antidepressant treatments that have been utilized at an adequate dose or duration, then you might be defined as having difficult to treat depression. A little thing that is sometimes misunderstood is that depression comes in different flavors. Depression can be manifest with people that have unipolar depression. That's by far the most common form of depression. There's a 17% lifetime prevalence, meaning about 35 million people just in the US would have this. But bipolar disorder, which is a condition in which people go up and then down and then back up and then back down, when they're experiencing a down state or depressive state, that depression is indistinct from unipolar depression. There's another variant of bipolar disorder called type 2, where people have never had an exceedingly high high, meaning mania. They may have experienced hypomania, which means that they may have felt a bit more energetic, creative, and felt like the desire to do more, but not necessarily gotten out into the stratosphere of what mania entails. So it's very important that when people suspect that they have a problem, that they seek out a medical professional just to be able to better define what's going on with them. Now, the reason I'm honing in on bipolar disorder is that bipolar disorder doesn't affect, say, 35 million people, but it affects about 2.3 million people in the US. Lana is one of those individuals. And bipolar disorder is the 6th leading cause of disability. In fact, approximately 83% of people with bipolar disorder are gauged as having a very serious impediment. That, by the way, is one of the highest percentages among mood disorders that we face clinically. There's a lot of expenditures tied into this problem. Bipolar disorder has a substantial impact on people's lives and can evoke a greater source of problems from an economic burden. In fact, of people that suffer with bipolar disorder, particularly when they're depressed, they may miss work, say 18.9 days out of a year. And people with bipolar disorder have been shown to be more than 4 times more likely to be unemployed because of multiple issues that come into play. Now, a lot of work has been done in this space, and part of the folly associated with some folks that suffer with bipolar disorder is that when they're not experiencing symptoms, they may think, I'm cured. I don't have a problem, so why should I take a treatment? Because half the time, patients might not be experiencing symptoms. But the other half of the time, when they are experiencing symptoms, guess what? The majority of that time, they're actually going to be spending in a depressive phase, not a hypomanic or a mixed or a manic space, but depressed. And so that's why it's important for us to have this awareness. Now, vagal nerve stimulation therapy is a very unique approach. And part of the reason by which we're having this discussion today is that a lot of people don't realize that this has been an FDA-approved treatment for patients 18 years or older who have tried and not necessarily gotten to where they want to get with exposure to at least 4, if not more, different antidepressant treatments. It's a small device that's generally placed under the skin, and generally that procedure is done in an outpatient procedure. Most people go home that same day, and it's a therapy that is with that person 24/7. That means that it's constantly working, and it might deliver years of improvement in depressive symptoms. But the problem is that a lot of people don't know about this. Now, vagal nerve stimulation is a proven technology that's not only FDA approved for major depressive disorder that's difficult to treat, it's also indicated for seizure disorder. And it's been extensively studied across multiple conditions. That means that we've had over 25 years of patient experience across multiple diseases, and over 125,000 patients have been implanted across multiple diseases. If you see this diagram here, it basically shows you what vagal nerve stimulation therapy is. It's not a drug. It basically is a way of utilizing natural pathways in our body. The vagal nerve is the 10th cranial nerve, and VNS is a therapy that is a device that works by stimulating the vagal nerve on the left side. So what we know is that the vagus nerve is connected to areas that are associated in the brain with controlling mood. We basically know that there's a lot of different connections that flow down into our body and then flow up into the brain. And vagal nerve stimulation therapy is not brain surgery. It's a device that works by regularly sending mild pulses through a thin wire that you can see on this slide that directly stimulates the left vagal nerve in the neck. Now, by sending these pulses, vagal nerve stimulation therapy has been shown to improve depressive symptoms, and we hypothesize that there's a lot of different reasons behind this. Now, the interesting thing here is that vagal nerve stimulation therapy begins with a one-time outpatient procedure. Generally, a neurosurgeon is involved with this, and the implant procedure takes about 1 to 2 hours. Typically, it's performed under general anesthesia. The surgical complication rate is low because we know that the infection rate's right around 1.6%, meaning less than 2 out of 100 people would experience that complication, but it's not zero, so it's important to have that awareness. The majority of patients are discharged the same day, and I'd be curious to hear Lana's experience once she actually initiates what she recalls of her procedure. Now, what we know also is that results with vagal nerve stimulation therapy appear to get stronger over time. Let me share with you some interesting data. In a 5-year study of 795 patients with difficult to treat depression, the results for those people that were implanted with vagal nerve stimulation therapy as compared to treatment as usual or traditional treatment by itself were superior. In fact, nearly 7 in 10 of patients saw significant improvement in their depressive symptoms when vagal nerve stimulation therapy was added to their usual treatment, and more than 4 in 10 fully or almost fully recovered from their depressive symptoms when vagal nerve stimulation therapy was added to their usual treatment. Now, in a more exciting manner, a separate analysis of patients with bipolar disorder with difficult to treat depression were also tracked in this registry study that was done over the course of 5 years. And what was noted was that when patients were being treated with treatment as usual, compared with treatment as usual plus vagal nerve stimulation, those that had the vagal nerve stimulators were 3 times more likely to have a faster overall time to reduction in depressive symptoms, and 2 out of 3 patients with vagal nerve stimulation plus their treatment as usual experienced a reduction in their depressive symptoms. Now, in this 5-year observational study, 1 out of 2 people with difficult to treat bipolar depression fully or almost fully recovered from their depressive symptoms, which ultimately is very important because keep in mind, they were already being treated with the very best things that were available to them, but now the big difference was having that vagal nerve stimulation added to them. What we also know is that there's a significant improvement in quality of life in patients that have depression, whether that's unipolar or bipolar disorder in a depressive episode, because in this 5-year study, there was a sustained improvement in quality of life when vagal nerve stimulation therapy was added to traditional treatment. And by the way, that basically meant that people felt well and their mood improved. Now, in addition to that, there was a significant improvement in sexual function. Now, this is really interesting because using self-reported results, patients stated that their sexual functioning was improving over the course of 5 years. And by the way, scores generally worsened when patients were receiving only traditional treatment. Now, the importance also is that with bipolar disorder, there's sometimes a concern. Could there be treatment emergent mania and or hypomania? And the neat thing with these trials is that there was a low incidence of this occurring. Vagal nerve stimulation therapy in conjunction with treatment as usual was associated with a low incidence of treatment emergent mania and or hypomania. Now, there's always two sides to a coin. So on the one hand, we've been speaking about all these virtues associated with vagal nerve stimulation. What's the downside? Well, keep in mind, vagal nerve stimulation is a therapy that has been proven to be safe and well tolerated. That's why it's FDA approved. It doesn't cause the same side effects that antidepressant medicines might cause, which could include fatigue, sedation, weight gain, dry mouth. And it also doesn't cause the same side effects as other medication-free treatments like electroconvulsive therapy or even transcranial magnetic stimulation, which could include things like memory loss or poor concentration. So it's definitely a different type of an approach, but there are side effects that are associated with it too. The most common side effects oftentimes occur when stimulation of the vagal nerve occurs, when there's that pulse, and hoarseness or changes in voice have been reported, as has been prickling or tingling in the skin, a sore throat, shortness of breath, or coughing. Sometimes as people are speaking and the stimulation goes off, there could be a little bit of a change in how their, again, speech is coming about. Most commonly reported side effect from the implant procedure is infection. We made mention, that's 1.6%. And most side effects are less noticeable over time, with side effects generally occurring during stimulation. But the beauty about this is that this is a device that can be modified based on the settings that are being utilized for the patient. Now, let me share with you guys some details about the RECOVER study. The RECOVER study is a new research study that is gathering more information about how vagal nerve stimulation therapy might be helpful for people with difficult to treat bipolar depression. The RECOVER study is basically earmarked to take a look at how patients with bipolar disorder with difficult to treat depression might come about based on two groups. One group has their vagal nerve stimulation turned on right away, and the other group has to wait 12 months before the device is actually turned on. But for the next 4 years, every device is turned on. What's that mean? It means that whether you're on group A or group B, you're actually being, again, given a vagal nerve stimulator. Group A has it turned on right away, so they're actually going to have it turned on for 5 years. Group B has to wait for 12 months before the device gets turned on, but for the next 4 years, they'll actually have the device turned on and reaping the potential benefit associated with vagal nerve stimulation therapy. Now, who is a potential candidate for being in the RECOVER study? Patients who are 18 or older, patients who are currently depressed, patients who have bipolar depression that's lasted for at least 2 years or recurred several times and have tried at least 4 antidepressant treatments, which could include psychotherapy, RTMS, ketamine, IV ketamine, esketamine, intranasal, and or multiple antidepressants or augmenting agents to help out with that depression and their current episode of depression. And again, those interventions haven't been helpful. And they also need to be receiving at least 1 mood stabilizing medication. Now, before anybody were to take part in a study, they obviously need to know that being involved in a clinical research trial is entirely one's decision. It's a voluntary issue. Patients are still entitled to receive medical care, whatever they decide. And they are generally being compensated for each study visit that they complete. HIPAA regulations very important, so confidentiality issues are taken into account. And even if somebody were to join the study, they're free to leave at any time without having to give any reason because it's completely voluntary. Now, what are the pros associated with being involved with this study? Well, you could benefit from an FDA-approved treatment for your depression, and symptoms of depression, when improving or potentially even resolving, could lead towards an improvement in quality of life, although there's no guarantees for that. Once activated, somebody will be receiving a continued antidepressant therapy that's always with them 24/7. And by participating, somebody through altruism might be helping other people to access this treatment in the future. You could also, by the way, get more healthcare attention than you would receive outside of the study. And for some people, that increased attention can be beneficial. But the other important thing is that you're still continuing to receive your usual medication and therapies. What I'd like to do now is actually roll over to Lana and have her give us her perspective of what it's been like to have been a recipient of vagal nerve stimulation therapy over the past 23 years. Lana, if you wouldn't mind taking over.
I'd be happy to. Thank you, Dr. Alva, for that introduction. I'm very happy to be here tonight. And I know that when Dr. Alva introduces me, generally, other than the VNS, we hear about playing piano, reading books, doing gardening, which may sound very boring, but anybody who has bipolar or loves someone who does knows that anytime that you can have a really happy day and feel peaceful, that is a great day. So in any event, I'd like to talk a little bit about my experience with bipolar depression, and then move on to how I got to VNS therapy and how things have been going since then. This is a familiar story. You've heard it before. It started in college, which seems to be an age that a lot of people first notice their symptoms. And I had a hard time sometimes finishing projects on time. I also, of course, would have those hypomanic episodes. I did not recognize them for what they were. They just seem like there's a very, very sweet spot in the beginning of my hypomanic episodes where everything is good, where this introvert is very outgoing and sociable, where I can do reams of high quality work with very little sleep. I can start projects, I can make friends, and all of that feels fantastic. Unfortunately, then some other things start to come in, irritability and making poor choices. And then finally, I'll kind of crash into a depression. Now, my depressions, I always knew what they were. And I didn't know really what to do about them, though. I had some talk therapy, which, by the way, I'd like to say that although talk therapy alone is not enough for bipolar depression, it is useful. Having someone who's in your corner, has your best interest at heart, and is willing to listen to you for 50 minutes every week can be very supportive and helpful. But having tried it and not having any effect on my cycling, I tried a bunch of other stuff that freshmen and sophomores in college would try, at least in my time. Transcendental meditation, for example. I thought maybe that would save me. Vitamin supplements, self-help books, trying to figure out what I was depressed about. I think I wasted a lot of hours trying to figure that one out. But none of those things really helped me very much. And then I started on medications. This would have been kind of my mid-20s, I believe. And started out with one medication, which didn't work. Then another one was added, didn't work. Let's add a third one. No, well, let's drop this one and add another one. And this kind of, polypharmacy cocktails or whatever. It was part of my life then. until I was 50 years old. And none of those drugs or combinations ever helped me. Occasionally, because I would cycle out of a depression, we think, oh, that one seemed to help, but that's not what had happened. So it was pretty clear after a while that medications, at least the ones that were available to us at the time, were just not going to work. In my 30s, I was married. I became a mother. I became a single mother, and I got a job that was fairly lucrative, but high pressure. I wanted to support my children well. And then I found that, unlike school, there was a complete different level of anxiety about trying to hide my illness and keep it secret. That's hard to do, and particularly since when you become depressed, you never know how long it's going to last. If you knew, okay, this is going to be a 7-day depression, then you can take a personal day, take some vacation days. You can, there are a lot of things you could do, but you don't know that. You don't know if this is going to be a monster one that sets in for several weeks or what. So I had a lot of stress around that, because I knew that in a competitive working environment, that the consequences of these frequent and prolonged absences were very high risk. They're just, that just added greater difficulties to me. What I tried to do then as I was working is, during my hypomanic phases, I would kind of raise my profile in the company, do a lot of really great work, make a good impression, and then kind of fall back and hope that no one would notice if I had a little dip in what I was able to do, or a big dip, as the case may be. As I got older, into my 30s and my 40s, the cycling was coming more often. It was more debilitating. And the hypomania I was acting out in more dramatic ways. I was doing foolish and dangerous behaviors. I drove too fast. I squandered a lot of money, and I dated too aggressively, if I can use that euphemism. And it was, that was bad. Those are bad things to do. The inevitable depressions after those hypomanic periods just got worse and worse. Mine were the type that I felt exhausted all the time. I wanted to sleep all the time. And instead of losing my appetite, I craved carbohydrates, which I understand there's actually a physiological reason for that. It wasn't just me pigging out with my Oreos. But in any event, those depressions would get to where my body would feel so heavy that I felt like there were weights tied to my arms and legs, like I could barely move. Everything required a huge amount of effort. And I've heard that referred to as leaden paralysis, which sounds very theatrical, I think, but it is something that does happen to some people during a difficult depression. So there was the physical fatigue, and then there was the effect, of course, on my cognitive functioning, on the ability to think, to concentrate, to make and execute a plan of any sort, to make decisions. It was, I just couldn't even read a book. It was kind of leaden paralysis of the brain, I guess. That's kind of what I'm thinking right now. But in any event, so my body and my brain not helping me a bit. I was just debilitated in both of these ways. Sorry, I'm looking at some notes because I don't want to ramble. We need to have time for Q&A. So,
all good. You're doing amazing.
Thank you. Okay. all of the pain and all of the guilt and all of the anger that I was directing inward for the things that I had done became unbearable. And I finally started thinking of my illness as an entity, as something outside of myself, as a cruel and cunning adversary that I had to fight. And I would think about the fact that every day that I was depressed was a day in my life that was gone forever. Every day that I was depressed was a day I could not be there for the people that I loved. I just had to fight that with everything I had. And I'm sorry, it still hurts. Finally.
It's really powerful. Thank you so much for sharing with us.
Finally, my psychiatrist recommended I do ECT. So we did 15 bilateral treatments, and they just weren't, they didn't help very much. And they really messed up I had a lot of memory loss and a lot of confusion from that. So that just wasn't going to be a good ongoing treatment for me. But unfortunately, my psychiatrist said to me that he'd done everything that he knew to do. None of it had worked. And that as much as he would love to see me get better, he did not know what to do. So I thought, well, okay, I still have that adversary. I'm going to continue this fight. I went home and I started searching the internet for treatments and development. And I found the clinical trials on VNS for depression at the University of Washington. I was admitted to that trial, and in September of the year 2000, and I was already 50 years old at this point, and I'd already lost my job from being ill too long, but there was some hope, right? I had my VNS, and I knew, I'd been told, that it would take a while for it to really start taking effect, and it did. So for several months, I felt nothing. About 4 to 6 months into treatment, I had happening with my daughter. She had a new stereo, and while she was gone to class, I was going to wire it up. And I thought, I don't know if I can even do this. I don't know if I can think it through and actually get this done. But I did it. And I would not have been able to do it just even a few weeks before then. So I thought, you know, something good is starting to happen here. And I certainly hoped I would get beyond the speaker wire stage, which I did. And over the next 18 months, well, 18 months total, I had these incremental improvements, got better and better, and was able to then really start fighting for my health, to exercise and get back to nutrition, many of those things that you need for your health, but sometimes you just cannot do them when you're really depressed. But that became available to me. So by 18 months after my implantation, I was feeling so much better. And I was also just feeling so grateful to have the VNS system. And I've had it, did I say, I've had it now for 23 years. I know Dr. Alva said that he's been messing with this for what, a quarter of a century? I'm right behind it. So in any event, that's my story. Did you want to hear about the surgery?
Sure. If we really saw that.
Okay. The surgery was much easier than I thought it would be. You do go under general anesthesia to have it done. A neurologist does it, but there's just a tiny little, slit, hardly invasive, where the device is implanted. And then the leads run up to your vagus nerve and are attached there. And I was surprised that because it was such a superficial wound, there really wasn't very much pain. It was just kind of a Tylenol and Advil level pain. It wasn't very painful at all. Other people may react differently, but honestly, just after a few days, I felt fully recovered from that. And I did have some voice alteration. They warn you about that, and that's a really common side effect. It gets better over time. I don't know if you can hear a little bit of hoarseness coming and going in my own voice, but that's what that side effect is. And as they say, it gets better over time. Also, your doctor can adjust your settings to control or reduce some of those side effects. And I just can't tell you how happy I am to be reading and writing, playing my piano and gardening and enjoying my life.
That's amazing. Thank you so much, Lana. That's really not only inspirational, but it's very courageous for you to, open up and speak about your experiences. Your information, though, is so revealing, and it's certainly useful to a lot of people that have no concept or, don't really know, have doubts, have, concerns, have fears. But it's really just refreshing having the opportunity of hearing your story and seeing the success that you've encountered. Now, obviously, I want to thank everybody for, being with us through this particular presentation. I did want to share with you all how, if you would want to partake in the Recover study, how to be able to access that. And there's a website, www.recovervns.com. There's a phone number, 877-669-4867. And remember, the study is being done right now for Medicare recipients who may be experiencing bipolar disorder and a depressive episode. But there is also, through LivaNova patient access program, there's a hotline, a support hotline. And obviously, speaking with one's doctor might actually help out with being able to get more information. I am going to leave you guys again with this information so as to be able to contact this. But more importantly, I'd love to take a few minutes to maybe answer some questions that may have actually been, gathered throughout the time in which Lana was, giving us her own tale, but also the backdrop information that I was sharing with you all. Sherry, are there any questions that we might be able to tackle right now?
Yeah, so our audience has actually asked some questions in the chat. And the first question is, will I be able to feel the stimulator when it is turned on?
And the answer to that would be yes. Generally, I think that Lana, you might be able to give us a great rendering of what you experienced personally, and I'll certainly,
Sure. Yeah, sure. Particularly when it's first turned on, you will definitely think, oh, what is that? I don't think I like it. But honestly, within 15 or 20 minutes, it's going to get better. And you'll have a series of steps where they will kind of ramp up the stimulation. And with each change, you may feel that. But as I mentioned, over time, you don't even notice it.
And what I wanted to share with you guys again were some of the potential side effects of the stimulation actually occurring, right? And people have talked about hoarseness, change in voice, a prickling or a tingling in the skin, sore throat. Most commonly, what I've seen when I'm setting the parameters is maybe a little bit of shortness of breath or coughing. So, obviously, there's going to be some variations.
Well, thank you. So our next question reads, can this be implanted, removed, and implanted again?
Dr. Alva?
Yes. So the answer to that is yes, it could be. But why would you want to do that, right? So the important thing is that here's a device that can actually be turned off with a magnet. So Lana, would you mind sharing with us how you may have turned off the device in certain times and what that's about?
Sure. You are provided a magnet, and if it's held over your device, it turns it off temporarily. In fact, it turns it off as long as it's there. Then when you remove the magnet, your stimulation starts up again. And so that is the nice way to know that if you've got an important conversation or some public speaking or something of that sort to do, that you have a way to turn that off, so that if you're having some voice alteration or something that you'd rather not have during that event, you have the power to do that.
Yeah. And what I've also encountered is that sometimes patients have a sense of, hey, it's really not doing anything. But in reality, as Lana made mention, sometimes we do have to be patient and wait. And, what these 5-year studies have shown us is that there appears to be a nice buildup associated with vagal nerve stimulation. And even though somebody might feel like the device isn't doing much of anything, that actually appears to improve over time. And so I would always say, let's be patient and see what happens.
Thank you. So, Lana, this next question is for you, and it reads, how often do you have depressive episodes after 23 years of having VNS?
Oh, well, that's actually a difficult question because I don't have them regularly anymore. Occasionally, I will have what I would call a depression, but it is never that really deep hole that I used to fall in. I always have enough energy to go out and take a walk. I may not feel like it, but I can do that. And I have a way really to fight back. It gives you a fighting chance against depression, that's for sure.
And if I may add, remember, vagal nerve stimulation therapy is an adjunctive treatment to treatment as usual. But what I've seen also with patients is that this affords an opportunity of being able to economize on medicines, meaning that you might actually be able to whittle down on the amount of medicines that somebody might have been taking. It's not a bad idea, though, to approach the situation with a treatment as usual, but you've got that extra something, right? As Lana made mention, with vagal nerve stimulation therapy, you've got something that you're wearing 24/7 and it's constantly working for you.
Yeah, that's great. And I just want to say how inspiring it is of how well you have been doing with VNS therapy. And I'm sure it really moves a lot of our audience members. And so let's keep going with the questions. Our next question reads, I have a job where I have to frequently do public speaking. Is the voice alteration when the pulsing happens extremely noticeable or impactful?
Dr. Alva, do you want to take that one?
Sure. Well, you guys have been listening to Lana, and every 5 minutes, she's been getting 30 seconds of stimulation from her stimulator. So you probably didn't notice anything. I think that probably Lana is maybe a little bit more aware of when that's happening. And some people talk about their voices maybe becoming a little bit more husky. But for example, as Lana was speaking right now, I couldn't even tell when it was going off, and it might have gone off several times, right, Lana?
Yeah, it did. But again, I think it's very important to point out that I have had vagus nerve stimulation for 23 years. So I've had a lot of time for that side effect to sort of smooth out and go away.
That's great. So moving on to our next question is, are hypomanic episodes more common, or has the hypomania been reduced as well, or neither?
And this question,
I think it's directed to you, Lana.
oh, okay, all right. Well, the VNS doesn't, is not designed to do much with the hypomanic part. And so my medications basically are responsible for managing that. VNS is there for me around the clock to protect me from those deep depressions. So I don't know actually if I've answered your question, but the VNS has not affected my the hypomanic part of my cycling.
And by the way, that's part of the reason by which in the Recover study, somebody should be on a mood stabilizer before rolling into the study. Now, despite the fact that there's a low likelihood of a manic or a hypomanic episode to occur with vagal nerve stimulation, it's not zero. But other therapies, when a mood stabilizer is not on board, there's a higher likelihood that, for example, if somebody with bipolar disorder is only being treated with an antidepressant, you might actually spark a manic or a treatment refractory state in that patient. So it's very important to be judicious about the management that one is receiving. And that's why it's so important to have one's doctor involved.
Yeah, thank you. So our next question is this therapy safe if I want to have children in the future, 3+ years away or so?
Absolutely. So there's absolutely no way in which this would affect the reproductive status of someone. And so, this would not have any bearing on that.
That's good to know. So another question is it possible to exercise with VNS therapy?
Yes, absolutely. So long as somebody is not doing extreme like MMA fighting and they're receiving blows to the spot where the stimulator is actually in place, right? Because you could potentially, hit the spot where the stimulator is, and that might create some discomfort or potential problems. But outside of that, absolutely. Lana, you look
Well, I would just say again, there are early side effects that go away. One of them is a lot of people do find a little bit of shortness of breath when they're working out really hard, but again, it goes away. But so if that should happen to you, don't think, oh man, I can't exercise anymore. You will, but I've heard people say that.
Yeah.
Well, that's good to know. So on to our next question is, does the device ever need to be updated or replaced?
So the device doesn't necessarily need to be replaced, but the battery might, right? So the battery has a shelf life. And so the interesting thing is that on average, it might last 8 to 10 years. Lana has probably had you've had one battery change, right, Lana?
Yeah, yes.
So Lana's has lasted, longer than most. But I've heard of patients where all of a sudden they felt like maybe they weren't getting as much benefit from their vagal nerve stimulator. And then subsequently, upon interrogating the stimulator, found out that the battery was very low and in fact now needed to be changed. That's also a relatively easy procedure that is handled by the neurosurgeon. But in this case, it's not putting in the wire that's looping the vagal nerve. It's simply pulling out the stimulator and switching out the battery.
That's good to know. So our next question, one of our audience members is curious, what happens if they go through a metal detector?
Lana, tell us about your experiences with that.
I'm trying to remember. I don't think it even sets off the alarm, but I haven't flown for a long time. Do you know, Dr. Alva?
Yeah, for the most part, it's not going to be an issue, although it's not a bad idea to let people know that you might have, a device that's implantable. And obviously that's why people carry their magnet too with them just in case. But it shouldn't be a problem, but it's not a bad idea to just let the TSA people know so that you're not necessarily dragged off to the side.
That is good to know. So our next question sort of stems from this one is, what if you need an MRI?
So for the most part, you can get an MRI, but you know what? It's there should be a mention made to the technicians of what's going on. Lana, I'm curious, have you had to have an MRI done since you've had your implant?
Yes, actually, I've had several. And I know that there is a protocol that needs to be followed in order to be sure that it's safe. And generally, there will be a representative from LivaNova, either in touch, with the technicians, or possibly even there, just to make sure it's okay. And so an MRI of the head you can do that. That's perfectly safe. And MRI of they're just MRI of anywhere in here you would not want to do. I believe that's the case, Dr. Alva. I know that's what I was told when I first got mine years ago.
Yeah. And for the most part, you're absolutely right. So, being in the neuropsychiatric space, I'm oftentimes thinking about a brain MRI, which is typically what I'm most interested in all the time. And generally, that's not going to be a problematic issue. But you're right, directly on the specific area in the chest region might be, a bit of an issue, but there's definitely a protocol to follow. So that basically means that the staff should know that you have a stimulator in place. But I've had patients that have been able to have MRIs of the head without any problem.
Well, that's good to know. And so that will be all the time that we have for questions today. I'd like to tell you, if you still have questions that did not get answered, please email jvolo@ibpf.org. That'll be J-V as in Victor, O-L-O @ibpf.org. And I do want to read one more thing. It's not a question, but one of our audience members said, "Thank you, Lana, for being so vulnerable and sharing your story. This kind of suffering is hard to understand if you haven't been there." And I would like to echo that statement. It was so amazing having you on today, and it story really touched my heart, and I'm sure it did many others as well. And another concluding note is that this webinar will be uploaded onto ibpf.org and will then be posted on our YouTube channel. And with that being said, I want to ask Dr. Alva and Lana if they have any closing words.
Well, again, thank you very much for the kind opportunity to be able to disseminate, share this information. And as I mentioned from the get-go, Lana, it's always such an honor and privilege and a pleasure to be able to, share time with you too. Thank you.
Yeah, thank you. And I guess I would just like to say that I know from personal experience how exhausting it is to keep looking for a treatment that works for you if you haven't had one, if you haven't been able to find one. But don't give it up. Your life is so worth it to get some quality of life, to get back to being a good friend, a good family member, to really enjoy your life. It's so worth it. Please continue your search.
Great.
That's so great. Well, with all that being said, I wish everyone a happy rest of their day, and visit ibpf.org for the recording. Have a great day, everyone. Thank you so much for joining.
Thank you.